happy to meet you, Dr. Hillock, and it's really great to be out here in Las Vegas for my knee. Tell me a little bit more about yourself and your practice. And
I'm a board-certified orthopedic surgeon. I've been in practice since 1983.
Mm-hmm.
I've been in this particular group for the last 5 years. I have 16 partners total in the group, and we cover the entire spectrum of orthopedic care.
Yeah.
My subspecialty is adult reconstruction and oncology. The oncology patients, they tend to be referred directly from the appropriate sources. The adult reconstruction patients are the ones that I get from various sources such as the
Right.
internet or from people seeking that service in particular. It's basically the treatment of arthritis and the surgical correction of arthritic-related deformities and problems. And sometimes it's referred to as joint replacement surgery. Particularly, I focus on the hips and the knees.
Mm-hmm.
Those are two of the biggest joints, and that is places where people tend to have the most problems related to arthritis.
How long have you been practicing medicine, and what's your background as far as surgery is concerned?
I've been practicing since 1983, and I have specialty training in adult reconstruction, joint replacement surgery, and tumor resection surgery. So it's the process of the diagnosis of the condition, the non-operative management of the condition until that is exhausted.
Right.
And then when we move into the surgical options and we try to pursue the least invasive option possible.
So, Dr. Hillock, the knee replacement, I'm a little bit nervous about doing this. It's something, I've been told I need, and knee replacement surgery kind of scares me.
So it's a big undertaking. It's a investment in time and resources. It's not something that you should seriously consider until you've exhausted all the other options available.
Okay.
So medical management, weight loss, injections, physical therapy, lifestyle modifications. And if after having gone through all those steps, the problem still exists, which would be pain and limitation of range of motion, limitation of function, then you can go forward with a clear conscience knowing that you tried everything else first, and it is the next logical step.
Okay. I think I'm at that point. I've tried all of those things you've told me about. I'm really seriously considering this, and I read something about a robot that might be able to help with this. I'm really interested to learn more about how that might work.
So the robotic knee replacement, the device is called Makoplasty, after the shark, the Mako shark, M-A-K-O. The robot is just another form of a cutting tool. It's a very precise cutting tool. The robot doesn't do the surgery, the surgeon does the surgery. In this case, I do the surgery. And the way the process works is that we obtain an MRI. We show that the arthritis is limited to one or two of the compartments in the knee. Mm-hmm. There are 3 total compartments. Instead of doing a total knee replacement, we only replace the components that need to be replaced, and we retain the things that don't need to be replaced, so the knee feels more normal.
Okay.
The benefit of using the robot is that we only remove the precise amount of bone that needs to be removed, and we retain everything that we can possibly retain otherwise. And so it is a bridging procedure. Eventually, it will need to be converted over to a total knee replacement, hopefully 15 or 20 years later.
Okay.
But this gets you through the active years of your life, gets you through your career until your demands are less.
Great.
With a total knee replacement, it would probably be a challenge to play tennis. Versus with the partial knee replacement, you could probably reasonably expect to return to playing tennis.
Well, I love playing tennis. And had other issues with that, with my Achilles, but we'll leave that for another day.
Yes.
I'm really interested to learn more about clinically how it works. Would you mind showing me with the knee device what it is that we'll be doing, or
Sure. This is the non-robotic knee replacement. This is a total knee replacement.
Okay.
This is the far extreme, but we replace the end of the thigh bone with a metal cap, and we replace the top of the shin bone with a metal and plastic cap.
Okay.
And so the bearing surface is metal on plastic, and the implants are designed to articulate very, very precisely. And the surgery is all about determining how to make the bone cuts to match the implant and to correct the deformity. And that's the expertise of knee replacement. With the partial knee replacement, instead of replacing the entire end of the femur, we only replace a portion that's arthritic. And that allows us to retain the cruciate ligaments. It allows us to retain the undamaged portions of cartilage. So the knee feels more normal, the knee functions more like a normal knee, it moves in a more normal fashion. So we have this example is of the medial compartment, or the inside aspect of the knee. This is behind the kneecap, or the patellofemoral component, and retaining the lateral compartment of the knee. And by doing it this way, instead of with the entire knee being replaced, we replace far less of the surface area of the joint. So there's less bone cut, there's less bleeding, the recovery is more rapid. This surgery is about 3 months to return to function. This surgery is about 3 or 4 weeks to return to function. I have, by nature working in Las Vegas, I have a fair number of patients who are in the service industries related to the casinos. I take care of a lot of waitresses, cocktail waitresses, dealers. They are returning to occupational function in 4 to 6 weeks, not requiring any medications, basically pain-free, versus a total joint replacement. They would probably be more like 3 months before they're returning to occupational function. They hurt less, they recover faster, the function feels more normal.
Right.
And as long as the arthritis is only limited to 1 or 2 compartments, it is the ideal way to go.
Well, it's interesting because those people tend to be on their feet all day, so if they can return to work a lot quicker, that's impressive.
The cocktail waitress, by what I've seen and what I'm told, they're walking 8 to 10 hours per day.
Yes.
And they're walking 5 to 10 miles in the course of their shift. Yeah. And with the partial knee replacement, they're able to go back to that function very quickly. Minimal time off work and reversing their symptoms, extending their career until they're ready to retire, not being compelled to retire.
Yeah, my only 4-hour walk is on a golf course, so it's not as intense. Tell me a little bit more about what you do after the surgery and how the recuperation would work with your practice and people that I'd be seeing.
So with the partial knee replacement, or the makoplasty, the recovery is typically 24 to 36 hours inpatient. We give 24 hours of antibiotics to prevent infection.
Okay.
We make sure pain is controlled, and by the time the patient's leaving, they're transitioned over to oral medications. We make sure that they're able to get in and out of bed safely by themselves. We train them on the appropriate use of a walker at first. They graduate over to crutches, then they graduate to a cane, and then by 3 weeks they usually don't require any type of an assistive device. Their pain medication requirements are typically gone by about 4 weeks. We can arrange for therapy to come to where they're living or staying, to begin physical therapy as an outpatient. If necessary, we can arrange for nursing to come to where they're living or staying. They are basically, if we get done early enough in the day, they're already beginning their therapy program by that afternoon. And it's a graduated program focusing on range of motion, strengthening, and conditioning, getting them back to an active lifestyle, getting them back to where they need to be to return to occupational function and sports.
Okay. Anything I should be aware of before the surgery? Anything that I should avoid doing, or in getting prepared for surgery? What should I consider? Well,
typically we send the patients to their primary physician, their internist or family practice doctor, for a checkup to make sure that they're healthy enough for surgery and healthy enough for anesthesia. make sure their heart and lungs are working appropriately, check out some basic laboratory tests to make sure that their vital organs are working appropriately. And the majority of patients who are candidates for the partial knee replacement, this is really not a problem. This can all be taken care of where they live. We will fax out information of what is required by myself and by the anesthesiologist. And we get all of the preoperative arrangements taken care of before the patient travels.
Okay. Tell me about your experience with, I'm coming in from another country, and tell me about how that would work. Say I'm coming from Dubai.
So the international patient, we treat all the patients the same once they're inside of the system. We make sure that the preoperative clearances are done in advance, and if they need to be done here, we can make arrangements for that to occur. The patient comes into the clinic for the first visit. We review the information. We review the radiographic images, so MRI, CT scan, MRI, or plain film X-rays, and we review the plan. We counsel them on what they're going to be doing during and after the surgery. We make sure that they understand the process. We counsel on what the expected outcomes can reasonably be, and we counsel on any potential complications and the things that we're going to do to prevent complications from occurring. And with any surgery, if a complication occurs, we'll continue to treat them as long as they want us to, or they'll let us.
Okay. So can you help me get over my fear?
Actually, fear is a normal thing that you would have prior to surgery. If you didn't have fear, then I would be more concerned, because this isn't a big undergoing that you're going to be doing. It's surgery after all.
Mm-hmm.
However, there's going to be a couple things that we're going to go through with our pre-surgery education, and you're going to be doing that with me.
Mm-hmm.
So I'm going to actually be going through all of your laboratory results, and I kind of go through them with you, because some things that your primary care doctor and you have talked about, you may not know that are a big issue. Okay. So the first thing that we're going to make sure is, just as Dr. Hillock had talked to you about, you went and saw your primary care doctor. Okay, so what I want you to do is you're going to arrive at the hospital at a certain time, designated time. At that point, once you do arrive, we're going to make sure that you're in the pre-op area. Anybody that comes with you, they're more than welcome to stay with you until it's time to take you back to your OR suite. Then what we're going to do is actually talk to you about your anesthesia and how that is going to work. So you're actually going to be meeting a lot of people throughout this whole entire process. There's going to be about 5 people at the hospital that you are going to be meeting. They're all going to be asking you your name, what we're doing for you, what side we're doing for you, your birth date, and any allergies to any medications. So you're actually seen by a whole team there. The surgery time itself, depending on which surgery we're doing, if it's the Makoplasty, is still going to be about an hour long. Dr. Hillock's going to come out and talk with family and friends once he's finished. You'll still be back in the OR suite with us, waking up and recovering. Okay? We're going to make sure that you've got functioning of your legs. We're going to make sure that your pain is well controlled, that you're not feeling like you're going to throw up or have any nausea issues. Okay?
I've never had surgery, believe it or not, at my age, but what is it like?
What is the surgery actually like, or what it's going to feel like?
As a patient, do I feel anything?
Actually, right when you go into surgery, you're not going to feel really anything, because we do give you some medication that's going to ease your anxiety. The staff there that you're going to meet are very friendly. We're with you the whole entire time. When you do wake up, you won't really feel any pain on that side of the leg, because we're going to give you some numbing medication. What you can expect, though, is when you do wake up, you may or may not have a Foley catheter placed in your bladder, depending on how long that surgery lasts. And if we think that you're not going to be getting out of bed that first day, we're going to make things very comfortable for you. We also start you with pain medication right away, so you will feel kind of like you're on vacation with this knee replacement done. However, here's the hardest part, and this is what I tell all of my patients, is the hardest part is you actually doing this program. The first time that you get up out of bed, it's not going to feel like your normal knee. You're actually probably not going to feel it at all, which is why we're going to put you in a large black knee brace. That's going to help you to walk and get up out of bed. Okay, and this is a normal standard protocol, which is why we use that front wheel walker. Okay. After that, though, every single day that you work with us as well as with the physical therapy team, you're going to get stronger. That knee is going to feel normal. Okay. The nice thing is we continue your physical therapy throughout, just not your hospital stay, but also when you go home. Okay, so we're going to have a set team even when you go home or wherever you're staying at.
Right.
At the hospital, there's going to be a recliner in your room, as well as, you have your hospital bed. I tell all of my patients, just like I'm telling you right now, I don't want you laying in bed. I want you sitting up in your recliner. Everything is wireless. You have your own private room. No set visiting hours. So have people come and visit with you. If you want to bring any of your movies or things like that, you have access to that. This will actually make you feel more like you're at home, recovering normal, get your faculties back with you. Okay? You're going to have a great support staff even when you're in the hospital. At any time you have a question, that's what I'm here for. Is I'm an extension of Dr. Hillock, but I will answer and make sure that everything you need, you're going to get while we get you through this process. After the surgery is completed and you do go back to your home or the inpatient facility or wherever you're staying at, we're going to bring you back here 2 weeks later. We're going to remove all of the staples that you did get during surgery, and then we're also going to be looking at your x-rays so you can see the implant. Even though I know Dr. Hillock went over what it looks like, I'm actually going to show you what it looks like in your own knee.
Oh, cool.
So that way you actually get a visual and you can see what's there. At that point in time, then we probably talk about a little outpatient physical therapy that you're going to be doing, as well as returning back to work.